So MRSA is a disease that you're probably likely familiar with, as it is very common in the community. So MRSA is a disease caused by a particular strain of Staphylococcus aureus, and this particular strain of Staphylococcus aureus is resistant to multiple antibiotics. So MRSA lesions could be relatively hard to treat because of the resistance of this particular strain of bacteria. So typically when MRSA is treated, it is treated very aggressively with multiple different types of antibiotics. So to talk a little bit about MRSA lesions, typically MRSA lesions are more localized, meaning they will pop up in one kind of individual spot. It's very rare that you'll see several lesions throughout the body. That only typically would happen if maybe you had one MRSA lesion and were picking at it and then touching other areas of your skin that had breaks. It could potentially spread that way, but typically it's more localized to one individual spot, and it typically results in a relatively large kind of pimple or boil. So what would happen is you would have some type of break in the skin, whether it's from a cut or a burn or whatever it be, and then the Staphylococcus aureus that's resistant to the different types of antibiotics would get in there and cause a MRSA outbreak. So the wound would become inflamed, it would be red to the touch, it would be warm to the touch, it would be red due to the inflammation. Obviously there would be swelling as a result of the inflammation, and then typically there would be pus coming from the wound. So those are all kind of indications that it possibly could be MRSA. People often ask where MRSA is found, and honestly, everywhere. Staphylococcus aureus is a very common bacteria throughout the community. There are different strains of Staph aureus, but MRSA strains have been localized or isolated from a variety of different surfaces. I put a few examples here. Gym equipment has been time and time tested for MRSA and is tested positive. And we have to kind of think, staff loves salt. People work out in the gym, they're sweating, so obviously gym equipment is going to be an ideal place for staph bacteria to be found. So incredibly important to make sure you're wiping down any gym equipment before you use it. But we've also seen MRSA isolated from airplane tray tables, electronic devices like cell phones, and even things like razors. You should really never share a razor with an individual because bacteria on the razors could be introduced into small cuts when you shave, which could potentially lead to something like MRSA. So really, MRSA is found on all these kind of inanimate objects, or fomites, if you will, and if you come in contact with those objects and you have some type of open wound, it's very easy for the MRSA bacteria to get in and cause an outbreak at that point. And MRSA is something that really does need to be treated medically. So you would need to go to the doctor. They would likely clean out the wound, which means they're going to lance it or open it up to kind of drain the pus, and then they're going to wash it out and clean it out. And then the really important part is that they're going to treat you with antibiotics. But because MRSA is resistant to multiple antibiotics, you typically don't just get treated with one antibiotic. You typically want to get treated with 2, sometimes even 3 antibiotics. That way, if the bacteria becomes resistant to one of the antibiotics that you're on, you have a second antibiotic that can kick in and get rid of the infection. So the key thing, it has to be treated with multiple antibiotics. There's nothing that you can do as far as like vaccination or anything like that. The only preventative measures you can take are just good hygiene. Anytime you have any type of wound, whether it's very small or large, any type of wound, you always want to keep it clean, keep it covered, because when you come in contact with surfaces, bacteria are present, it can get into the wound and could potentially cause something like a MRSA outbreak. So really, just good hygiene is the only thing that you can do to prevent acquiring MRSA. Necrotizing fasciitis is a terrifying disease. I've never seen it personally, but just from learning about it. It is a fast growing, very, very traumatic disease that can lead to death and amputation and all different types of horrible things. So this is one of the exceptions to the rule that I was talking about, and it is a flesh-eating disease. Most microorganisms are not flesh-eating, but this particular one is. So what would typically happen here is you would have some type of break in the skin that you would not be keeping clean and covered, and bacteria would get into that wound. The bacteria that have been linked to this specific disease are various different types of Streptococcus and Vibrio bacteria. Streptococcus bacteria are found throughout the environment on various surfaces. Vibrio bacteria are more commonly isolated from contaminated water sources. But these bacteria would get into the skin wound, and they would essentially cause the skin around the wound to become necrotic, which basically means that they would cut off it would induce destruction, where it would cut off the oxygen supply to the tissues around the wound, and that would cause a darkening of the tissues, and whereby we say it becomes necrotic because it's essentially dead tissue as a result of oxygen loss. The scary thing is that this infection can spread very rapidly. So it can go from a very small localized lesion to something like we see in the picture here, taking up a large surface of the body within a matter of hours. So it spreads very, very rapidly, and it can spread throughout the tissues, but then also get into the blood, where it could cause sepsis, which leads to a drop in the blood pressure, which can ultimately lead to coma and death. Treatment is very invasive, so you can't just get it treated with antibiotics. I mean, antibiotics are the primary treatment, so you have to get antibiotics, but the problem is, around the wound site, the infection has destroyed blood vessels, which has led to the necrosis. So unfortunately, the medication is not able to get to the wound site very easily through the blood because of the destruction there. So in addition to taking antibiotics, you also have to have the diseased tissue surgically removed. So obviously, the faster it spreads over the larger region of the body, the more invasive the surgery is going to be. If you catch it very early on when it's just a localized spot, you can get antibiotics, you can remove that small amount of tissue and might just have some minor scarring. But obviously, the more it spreads, then you're talking about potentially something like an amputation. Because again, this infection will spread throughout the tissue very fast. It will spread to the muscles. It will spread to the fat, all different types. It has a very invasive spread. So typically, as far as, again, treatment, it is antibiotics, but it is surgery to remove the infected tissue. So you want to catch it as soon as possible to prevent as much or as minimal surgery as necessary. But again, it spreads very fast, usually within a matter of hours. So really, time is of the essence here. As far as prevention, there's nothing that can be done in regards to like vaccinations. But again, it comes down to good hygiene. So you have to make sure anytime you have a wound, you keep it clean, you keep it covered. Because if these bacteria would potentially get into the wound, there is a chance that it could cause something like this. And again, with this, you would want to recognize those dark necrotic lesions as soon as possible and go to the hospital right away so that you can start the treatment process before it has the ability to spread and ultimately lead to amputation or even something like death as a result of sepsis.